let's begin by recognizing that the typical dental patient doesn't have insurance on their mind 24/7, 365. The only time they ever think about it is when they're in your office. But they don't really, think about it. And many people, um, you know, leave benefits on the table. They have needs in their mouth regarding their oral health. They need things. They have benefits that will cover it, and they don't take advantage of it. Naren, do you know that less than 20% of all patients who have insurance fully utilize their benefits every year? Less than 20%.
That makes sense, and I'm not surprised. Like a lot of people do not use their benefits.
And that just shows you how little they think about insurance. They have needs in their mouth, and they don't take advantage of the benefits that they have. So, and by the way, you're going to get zero. Do you think the dental insurance company is going to send a message to them saying, hey, you've got benefits left. Be sure to get into your dentist and use them. No, the insurance company.
Absolutely not.
In fact, the insurance company really, their dental insurance company wants your patient to never visit your office. I know that sounds harsh, but that's the gosh honest truth. They
Mhm.
don't want your patients to go to the dentist because if they never go to the dentist, they're never going to have to pay any claims, and that's
Right.
really what they want. So we have to take on that project ourselves. We have to let our patients know, and so really it's a simple message: use it or lose it. And some of you might be thinking, well, what if I'm already, we've gone out of network with some plans, and I have patients, we've gone out of network. Is this something that applies to them? Yes, because even when you're out of network, you want to help your patients fully utilize their benefits. I think, Naren, that's one of the unique things about our coaching when it comes to helping offices successfully drop PPO plans. There are consultants out there, I won't name them, but there are consultants that want you to basically wash your hands of insurance. Just literally hand the patient a claim form and say, here you go. Now, whatever you do from now is up to you. I completely disagree with that. I could not disagree more. I don't think that's very consumer friendly. The average patient has no idea what to do with the claim form. No idea. So we're still going to file their claim form. We're still going to submit all the documentation. We'll even do some follow up on behalf of the patient to get the insurance company to do what they're supposed to do. And our goal is to help our patients utilize every dollar of benefit that they have. So just because you're out of network does not mean that you're not involved with insurance. You're not involved in a good way. You're not involved in the PPO plan setting your fees. You've stepped away from that by
Right.
going out of contract. But we still have to submit, we don't have to, but I recommend that we submit claims. I recommend that we follow up on claims because that's part of our mission to help your patients use every dollar of benefit that they have. Does that make sense?
Absolutely get it. Yes, it does make sense.
Yeah. And this messaging, use it or lose it, is part of that campaign. So really what I find the seasonality of this is important. It doesn't make sense to start talking about this in the middle of summer. It doesn't make sense to do that in the middle of summer. Um, because, when it's 100 plus degrees, people aren't thinking about the end of the year. They're not. However, every year there's kind of a symbolic end of summer, and that's Labor Day. It's not the meteorological end of summer. That's September 21st. But the summer is thought by many people to be Memorial Day to Labor Day. Memorial Day to Labor Day is summer. Um, However, I find that when we get into October, about the time that this episode is published, when we get into October, people are starting to see the end of the year on the horizon. They're now fully into Halloween coming up and Thanksgiving coming up. I mean, all you have to do is go to the grocery store and see the Halloween candy aisle, and the costume aisle, and people are starting to think about that. Oh, and another little cultural symbolism is when Starbucks comes out with their pumpkin spice latte. The orange cups and those pumpkin spice latte. That's kind of a symbolic, timing of fall. So this is a good time to get the message out. Use it or lose it. I'd recommend that you communicate with your patients, and we call it the end of the year insurance letter, and just let people know that although treatment is never dictated by insurance, if you do have any needs or concerns, it might be good to get you scheduled before the end of the year to help you take advantage of any insurance that you might have. And I like to say that when the clock strikes midnight, December 31st, when the clock strikes midnight, December 31st, any unused benefits do not carry over for you. They go back to the fat cats at the insurance company. And that's the language I would encourage you to use. Any unused benefits go back to the fat cats at the insurance company. And that would be a shame. If you have any concerns, would like to schedule an appointment, call our office. We'd love to help you get taken care of. And I'd recommend sending that out by email, sending it out, and maybe even in a postcard type format, a use it or lose it. Use it or lose it is another great messaging. Use it or lose it. If you don't use it by December 31st, it goes away. Use it or lose it.